Hey, welcome to my podcast. My name is Dr. Brendan McCarthy. I am the Chief Medical Officer of Protea Medical Center in Tempe, Arizona. Thank you so much for tuning into my podcast. Welcome. Today we're going to be concluding our talk on autoimmune disorders and how we treat them, how we approach them. And if you're just tuning in for the first time, there's several videos we've made so far, and you can look for them on our YouTube channel or wherever you get your podcasts. I'm sure there's some snippets you might have seen out there on Instagram or reels on Instagram or Facebook or any of those places. But at the end of the day, the most information you'll get is going to be on these podcast episodes, the full deal. We give you all the information you need. So this is an important topic, and I say that about every episode, don't I? I do, because I think these are important. This is the massing of 20 years of experience in practicing medicine, and I wanted to distill down the most important things that I see in practice into these videos. And so, yeah, they all have importance. And if you're someone that has autoimmunity, or if you have someone you love has autoimmunity, it is important, and it is dear to you. So this is important. So before I get into it, I would like you to please, if you're on YouTube or wherever you are, please subscribe. And if you like what we're doing here, like it. And if you think that someone would benefit from this information, please share it. With that said, I want to dive into it. Treating autoimmunity is so, let me put it this way. A woman presents to clinic. She has lab work done. Her care provider finds signs of autoimmunity. They find anti-nuclear antibodies. They find any of these metrics associated with autoimmunity in their body elevated. They're referred over to rheumatology. Rheumatology looks at them, and they're going to prescribe a medication that's going to suppress or modify their immune system. And they call it a day. That's the therapy that's available. I'm not against that. And it would be ridiculous for me to get out here and say I'm against it. Because so many of you, it has saved your lives. And that's the thing about alternative medicine that's out there that really gets under my skin, is that they're just so anti a therapy. And they'll say, you shouldn't be doing that drug, or you shouldn't be doing this medication, you shouldn't be doing this therapy. This is synthetic, this is bad for you. And some of these therapies have side effects. Let me say that. Some of these therapies most therapies will have side effects when you're treating it that way. With suppression and modulation like that. The thing is that if you're the person who has the autoimmunity and it is attacking your body, and your body is the one that has been compromised and you are the one suffering, sometimes it's whatever we can do to bring you into balance, to stop the process from harming you. I'm saying this for a reason. There are those of you out there that would refuse care because you feel like you've given up. When you do that, you're giving up, and that you're a failure by taking these therapies. And I know this, and I see you. And I've sat in the room with you. And I want to say that you're right, and there's a challenge to you for this. I want to challenge you this. You're right in the sense that you can modify this. You have power in this equation. I want you to know that. And most of the people with autoimmunity are women, so I'm speaking to you women. You have power in this, and you are right. Okay? Trust me. I know this. I'm going to show you how you have power. I'm going to show you how to use that power. I'm your man when it comes to that. It's just that it's not failing to just stabilize yourself. Sometimes you have to use these things to put a pin in it so it doesn't progress, so that you can do this work over here to make it better. Rheumatologists work hard to stabilize you. And I know not all of them are great. I know some are bad. I know some are, but let's give everyone the benefit of the doubt and see the best in all people for a moment. This person's dedicated to doing their best to stopping this progression, and they are there in service. And that's what they want. And sometimes they become very much anti-alternative therapies. I know this. I deal with them all the time. And I want to say they're not always, they also have a challenge in this. There's nothing wrong with you using alternative therapies that would benefit you. There's nothing wrong with doing diet. There's nothing wrong with the supplements I'm going to recommend. I'm going to discuss some prescriptions that are a little out there for them, but they shouldn't be. And I'll discuss that why. I sound like I'm rambling. I won't sound like I'm rambling in a moment because I'm going to bring it all together because that's critical. What I'm trying to say is that this healing happens on a spectrum. And where you are in your pathology is where we need to meet you. And when we meet you there, our goal is to escort you, to stand by your side, and to work with you and guide you the whole way to the best part of your health possible. That's what we do. That's what doctors meant to do. So to the degree the doctor does that is the degree the doctor is going to be helpful. Some doctors are only going to be good for you on a small part of that spectrum. And you use another doctor to get you further along. Okay, that's true. As long as we put that into perspective and we realize we don't want to just keep you locked in just here and we want to move you all the way over here, we're doing the right thing. So, all right, I hope that helped to start. Now let's get back into autoimmunity and what on earth we're talking about. I'll remind you, what is autoimmunity? Autoimmunity is when your immune system looks at self and doesn't recognize it. It's when your immune system looks at yourself and says, you don't belong here, and they start attacking you. Okay, so that's that thing. There's this microclimate. So it's back to this whole thing we discussed in a previous episode. When your immune system goes over and looks at cells of self, it's always looking to see whether it belongs. So it's looking at different markers on the cell surface. Oh, this is ours. This belongs here. The microclimate has cytokines, this interleukin-4, interleukin-10. It has cortisol, progesterone, androgens such as testosterone or DHEA. When those are present in that microclimate, it's not an inflammatory climate. And the immune system looks at those cells of self and it recognizes self and it moves along. Now, if that climate is not anti-inflammatory, but more pro-inflammatory, that's rich in like interleukin-1, interleukin-6, tumor necrosis factor alpha, estrogen, prolactin even, that environment, you're going to have that higher incidence of a chance where the immune system sees self and says, aha, you don't belong here. I have a problem with you. That microclimate is really an important target for treating autoimmunity. And that's where I want to start. So how do we balance that guy out? What do we do? So those interleukins that I mentioned earlier, how do we bring a balance to that? How do we move you from the inflammatory to the less inflammatory? What does that take? You know, if you have autoimmunity, I'm sure you've heard people say diet is the best thing for it and you want to eat healthier and all these things, or you'll see online supplements. A lot of these supplements are geared to pushing those interleukins over to the less inflammatory versions. So pushing those interleukins over, you know, big things you can do, curcumin. You know, this is the thing. There are so many people out there selling curcumin on the market. It's a very common supplement, and you'll see it out there for autoimmunity, and people are like, oh, this is the best thing. What it is an anti-inflammatory. And there's a lot of discussion and argument about the bioavailability, how well you're able to absorb curcumin from the food that you eat. So that's what gets them to sell these products. And these products are like, well, some products are better absorbed than other products. So you should take ours because ours are more bioavailable, and you'll see it in the labs. The thing is this, you know, I'm not going to sit here and promote supplements first. I'm going to promote diet. I'm going to say that the people who have the less amount of autoimmunity or the least amount of inflammation will put, you know, curcumin in their diet more. They cook with it more. Turmeric would be in their diet quite a bit more. And you could see that in like curries. You could see that in a lot of different spice profiles that are not common for some of us. I was just thinking, my ancestry is Irish, and so we don't like mayonnaise can be spicy for us. So it's the thing. But that doesn't mean we shouldn't try to incorporate these foods. So when I tell my patients I want them to start incorporating anti-inflammatory foods in their diet, I don't want them to make such a radical shift in their lives that they're just take apart their entire diet and now they're going to do is eat curry every meal. I'm not going to tell them that because that's not sustainable and that has the highest rate of failure. But I will say, let's find some recipes that you like with turmeric in it that have a higher rates of curcumin, which is the active ingredient we're discussing in there. What about ginger? Ginger's the other one. Ginger, I love ginger. Put ginger in things. Cook with ginger more frequently. Shred ginger up, put it inside of a stir fry. Cook it with your vegetables. Adding those two things alone would be brilliant for you. Again, there's a lot of dialogue and chatter out there digitally about the bioavailability of these things. I'm going to tell you that the people who argue those things have a paycheck attached to their argument. I have none. I'm going to tell you honestly, eat the food first. And then if your doctor sees the metrics are not working as well as they want them to, they'll try supplement. If that's not working as well, but heck, we do IV. There's IV curcumin that is available. I don't do it in my practice. We refer out for that. But there's a lot of different ways of getting curcumin in your body at certain levels. There's ways of getting these compounds into you naturally, natural compounds into you. That's not the natural way of doing it. IV curcumin is not the way to do it naturally, but it is that is available, and it has been researched, and there's a process for that. That is something that you could do. But my point is you start where you can first. So ginger, turmeric, which has curcumin in it, EGCG, and that's found in green tea in super high levels. EGCG is also in white tea. It's also in black tea, but green tea's got mountains of it. And if you just drink 1 cup a day of green tea, or say you're going to your favorite coffee shop, just get an iced green tea once a day, or maybe once every few days if you can't do it more than that. Not everyone likes green tea, I know, but it is something you can start to enjoy over time. You can develop a taste for it. And it's one of those things that it's worth doing. It's sort of like your mom saying, eat your spinach. You know what I mean? When you're a kid, your mom's like, you gotta eat your vegetables. This is like that. So you can get yourself to consume more of these things. EGCG is found in berries. And, if you've watched my podcast before, I rave about berries. Berries are the best thing for you, period. If you just eat like blackberries, or blueberries or any of these dark skinned berries daily, you're going to be good. You're doing your body an amazing thing. And the antioxidants and the polyphenols, the compounds in there, when it comes to modulating your immune system, are proven. And lab work will verify these things. I want you to know that whenever I do diet and these supplements, if I use supplements, but mostly diet, I will use lab work to verify I got traction with them. Okay? I'm not going to tell you to do this diet and be some hippie on the side of the road, be like, eat this way. And no, I'm going to be a physician. I'm going to run my lab work. I'm going to verify that that's what's going on. I'm going to verify that my therapy works through lab work. Objective data matters. So those are the 3 big ones. After that, we talk about using extra virgin olive oil. There are polyphenols on there that also modulate the immune system away from the more inflammatory to the interleukin 10 and 6, of course. We know that quercetin and astaxanthin. Quercetin is going to be found in it's a weird place they find it. The pith of oranges or grapefruits, the white part of the peel, has a ton. It's bitter, but that's where you get tons of quercetin. So quercetin is in your citrus, but mostly in the white. No one wants to eat that part. But still, that's where you'd get it. Astaxanthin, that comes from salmon, shrimp, seafood does have astaxanthin. These things all push that pathway more towards the anti-inflammatory 4 and 10 interleukin. And diet, again, is our best thing. So we talk about recipes. We have nutritionists on staff that'll help you cook, figure out how to cook something that you would actually eat and enjoy. And we do our best to make that something that's sustainable for you. I want to be better than the doctor that just prescribes you things. I want to help your lifestyle and move your immune system this way. It's not just better just for your autoimmunity, but it's better across the board for your overall wellness. What else do we do? What else, Brendan? That pathway of inflammation of self versus self is, as I mentioned earlier, not just cytokines. There are hormones involved. And this is why women, you guys have the highest rate of autoimmunity, is because that estrogen estrogen is going to be part of that pro-inflammatory process at the microclimate, and progesterone is the opposite. And we know that prolactin is more pro-inflammatory. We know that cortisol is less inflammatory. Androgens like testosterone and DHEA are less inflammatory. So it's very important for me to treat the endocrine system while we're treating autoimmunity. How do we do that? We run lab work on women to find out where their cortisol is. We do a fasting morning cortisol. We would use those heart rate variability monitoring I mentioned in the previous episode. We want to see where your stress is, and we want to treat that. We never want to let your cortisol be too low. Sometimes we will use low-dose hydrocortisone to bring you into the normal range while we're working with everything else. So we prescribe low-dose hydrocortisone to bring you, a little bit higher. So if you're below 10 on your AM fasting and we want to bring you closer to 18, we'll give you a little bit of low dose hydrocortisone. Now there is a circadian rhythm. Those of you out there are like, Brendan, you can't just use the morning fasting cortisol. You can, but I am aware there is a circadian rhythm where cortisol is high in the morning, it goes low in the evening. Okay. Some people, their circadian rhythm is moved over where they're higher in the afternoon or the evening. I know that. But what I'm discussing now is when you do this panel, you want to make sure you have that spike in the morning and nothing in the afternoon and evening. There's symptoms I look for to see if that is spiking in the afternoon and evening, in which case then I would do a cortisol times 4 panel. And that's how I diagnose low cortisol. So you test them 4 times in the day. But for just today discussing treatment, just say they just had the morning. I treat them in the morning. I make sure their cortisol is getting to that rhythm, to the level they should be. You don't give them too much hydrocortisone. You just give them just enough, just to get inside the sweet spot where it should be in the morning, closer to 15. That's a good number, somewhere in that neighborhood, closer to 18. You don't want to be above 18 at all. You want to be right underneath it. You want to be above 10 for sure, closer to 18. And you get the best you can with your patient. You won't need to be on hydrocortisone for very long because hydrocortisone, your body will regenerate cortisol. Your adrenal gland will get better. It will recover. But this is just one of those things that'll help short term and reduce inflammation and benefit that microclimate. So women have a higher incidence of autoimmunity because of that estrogen and that microclimate and estrogen dominance. Estrogen is beautiful and good and we want it. I'm not vilifying estrogen. You need it. It's just when it is the sole ingredient there of that climate, you need progesterone there too. You need balance. So we run our labs with our women and see where their estrogen is. We see where their progesterone is. If they're too high in estrogen, we want to understand why. Then we use therapies that help bring that back into balance. If the progesterone is low, that's usually the more common of the two. Low progesterone, we want to figure out why they're not ovulating. Most women are not ovulating because of high stress, to diet. There's several different reasons, and also life, where you are in your life. As we go through life in your late 30s, you don't ovulate at every cycle. You have lower levels of progesterone. So then our goal would be to give you progesterone. We do bioidentical natural progesterone, oral micronized progesterone, do 200 milligrams at night before bed, sublingually dissolved. You have your best absorption rate. You use lab work to verify, and you make sure you get the progesterone up. We also, on the back end, we do continue working on why they're not ovulating. Can we get them to ovulate? How do we get them to make more progesterone naturally the best that we can? But right now, to balance that microclimate, get them on progesterone. Cortisol, progesterone, what else? Androgen's tricky. And androgen is one of those things that people, a lot of doctors get really weird about. I have estrogen. I have to have estrogen. If I don't have estrogen, I would not be a healthy person. You have testosterone. You should have testosterone. If you don't have testosterone, you're probably not a very healthy person. This is a fact. We're supposed to have these hormones in our endocrine system at different ratios, though. As a man, I should have my estrogen be on the lower end, my testosterone on the higher end relative to a woman. That's it. And same to a woman. They need to be higher estrogen, lower testosterone. That doesn't mean you shouldn't have testosterone. Androgens modulate that autoimmunity. That is a fact. That can't be argued. That is in the text. That's in the literature. That's proven that androgens play a huge role in modulating autoimmunity in a positive way. So we do use testosterone. We do use DHEA. And DHEA deserves a whole series on itself, and I'm going to work on one. It probably won't be as popular. No one wants to watch a DHEA series. Sorry, Justin. I'll do it like in a year or two, maybe. These are not popular ones, but it is a good one to discuss. DHEA is a adrenal androgen that is so important for modulating the immune system. It's important, and if it's too high, it's not good. Too low, it's not good. It needs to be in a sweet spot. But yeah, when DHEA is low, autoimmunity is more possible, and we treat autoimmunity with DHEA, and you'll see it works. Again, lab work. The final one's prolactin. Prolactin, it should be around 4. I know people say that's the lowest end of the range, Brendan. The range says 4 to 12. Yeah, it does say 4 to 12. You don't need to be lactating. Prolactin is the neurosteroid that triggers lactation, and you don't need it above 4. The higher it goes above 4, the more it's inhibiting ovulation. So that's lowering progesterone. The higher the number is, the more you're affecting that microclimate. So let's have it lower for the 2 reasons. One, prolactin in and of itself is pro-inflammatory in that microclimate of self versus non-self. Okay. And prolactin, when it's elevated, inhibits progesterone, and progesterone is also anti-inflammatory for the cells of self and cells of not self. When you're trying to figure that out, when you have progesterone at the ideal levels, you're in a better place. So that's your hormone component. I saved the best. I saved the best for last is diet. Diet is so. Let's talk about this with Justin earlier today. Diet is the thing. I know I'd mentioned earlier supplements and versus compounds in different foods. I'm going to talk really about diet for a moment or two. Autoimmunity is strongly linked to something called leaky gut syndrome. And leaky gut is when the cells that line your intestinal tract become compromised and instead of being tightly bound together, tight junctions. So here's your food going across there, and here's the cells, but they're, instead of being close together, they're spread apart. In other words, food in your intestinal tract is able to kind of sneak past it and get into circulation. That's what leaky gut is that no longer is that barrier between the intestinal tract and inside your body, the circulation. It's no longer tight, it's open, and food that's not fully digested crosses into your bloodstream, and your body's like, well, why is this here? It shouldn't be here. It should be in my intestinal tract. That is strongly associated with autoimmunity, powerfully associated with autoimmunity. And it is so important to address that with people. Diet causes leaky gut in a lot of ways. I know there are other factors. There's biological factors like there's bacterial infections. There's a lot of things that could trigger it. But at the end of the day, let's talk about diet here. If someone is eating a very processed diet, we know that the compounds found in processed foods, synthetic compounds, trigger and also contribute to leaky gut syndrome, where your cells break apart. So when I have someone with autoimmunity, I really get after diet. And there's two diets I would use. The first one I use is the Whole30 diet. Now, the Whole30 diet is, I think, one of the best out of the box, so to speak. You just open the book and run that diet. It works. It just does. I've yet to have a case where it didn't have some improvement by doing Whole30. And it's easy. Just Google it, look it up. There's great books on it, great recipe books. It is such an easy diet to follow. What if that doesn't do the right thing? What if it's not enough? What else do we do? The Gundry protocol, which is lectins, going after lectins in your diet, is the other one. That's a little more specific, and it takes a lot of work to do. And that's when you're avoiding certain compounds, lectins, that are found in some types of foods, beans being the big one. But lectins are a lot of different foods, and you can still eat those foods if you're very careful with how you process it. Lectins are naturally occurring compounds that come in the plant world, and lectins are meant to irritate the intestinal lining of the animal that eats it. That causes it to pass through quickly, so that it can be like if you ate a seed, you would consume it, and it would basically shred its way through your body quickly in order to be released, and it can be fertilized and grow. It's like part of the circle of life. It's important for the plant, but it's not good for us, because by irritating our intestinal tract, it's speeding it through. But if that irritation on the intestinal tract is causing it to cause that inflammatory process of leaky gut syndrome, where the cells no longer adhering to each other and complex food particles are able to get in your bloodstream. So when you consume lectins, it really can contribute to and compound autoimmunity, and in some cases even trigger it. So again, that type of diet, while it's much more difficult to pursue, we do it. And I use lab work to verify it worked. These processes we do are not easy. This is not an easy thing to treat. One more thing to bring up in here. This is the trickiest one. This is the last one. I know this is a long episode, but it's important. And this is the one I use a fair amount. And it seems very alternative, but it's not. And that's low-dose naltrexone. Low-dose naltrexone. Naltrexone is a medication that was released decades ago to treat opiate addiction. When you take naltrexone, it blocks the opiate receptors. So when you do an opiate drug, you don't get the same euphoria. You take the drug and there's nothing. It became popular. It's not super effective, by the way, for opiates, but it was repackaged and put out there in something called the Sinclair protocol, where they use it for alcohol dependence also. Now that has better success rates, give or take the person who's using it. when you take naltrexone and you drink alcohol, you have no release of dopamine. You don't have the benefit. So you take in the alcohol and you drink it, but it doesn't cause that release of those opiates. So you don't have the euphoria. You don't have the benefit. You don't really get much off of it, So that's the part that makes alcohol addictive. And so when you block that pathway, people are on that Sinclair protocol is they keep taking naltrexone every day. Every time they drink, there's really no benefit to the alcohol they drank. And then over time, they stop being addicted because it's called extinguishing. It basically extinguishes the addiction. That's an interesting protocol. And I've seen it work pretty well in some cases. How on earth does that affect the immune system, Brendan? Good question. Studies show when people stopped taking their naltrexone, as naltrexone was leaving their body, their autoimmune conditions were improving. True. And they started understanding, like, why was this happening? Why are people getting better from naltrexone? Turns out, when you do very low dose naltrexone, when there's a very little bit in your body, not a lot, but just a little bit, about 5 milligrams, and by way of dose differences, it's going to be 50 milligrams for alcohol dependence. You give 50 milligrams a day for naltrexone. When you're doing 5 milligrams or very low dosing, low dose at 5 milligrams every night before bed, what it does is it helps reset the immune system. When you take low dose naltrexone, it blocks the opiate receptors, and that causes your brain to be like, hey, we need more opiate in that area. So you start making more natural produced endorphins or opiates. That higher amount, because you do that temporary block, your body makes more, and then the naltrexone wears off. Now your body released more naltrexone. It's sort of like a bait and switch. It's a way for your body to surge a little bit more natural endorphins into that space of self versus non-self. And that's been shown to put autoimmunity to rest. I have seen this work in thyroid. I have seen this work in Hashimoto's. I can't believe how well it worked the first time I saw it. It blew my mind. Naltrexone is incredibly inexpensive. 5 milligram dose is incredibly inexpensive, or it should be. And it works. So I prescribe that. Now, do rheumatologists prescribe it? Sometimes. But to be honest with you, the people who discover this and publish this are rheumatologists. It's just, it's not a very financially benefiting, that's a horrible thing to say. Medicine is a business. It's a business. And sometimes the shiny things that make money are the things everyone gravitates to. The things that have the fancy commercials on TV if you're in the States. Can you believe we have all these, we have ads for drugs on our TV and radio and internet all the time. Go to your doctor, tell them to try this. These things get they get the attention. Low dose naltrexone, this is cheap and easy. Still, it works, and I'm a huge advocate for it. So I hope all that helped. I threw a lot at you in a long episode here, but I wanted to give you as much as I could. And at some point, I will circle back and do more on these individual therapies, talk a little more DHEA, and I'll do a few episodes on LDN, low-dose naltrexone, in the future, because these things are also important to go over. But I wanted to give you a rough idea how to approach autoimmunity. Again, these certain compounds found in foods to affect inflammation, these certain parts of your hormone endocrine system to create more balance, these things we can do in your diet that are a little bit more healthy. These things all come together to benefit you. So again, thank you so much for tuning in, and I hope to see you at the next episode.